I'll be talking to you guys about the top two STDs that are in the USA today and ways to prevent and protect yourself. So the top, do you guys ever wonder like how many people get an STD or how you can get it, or what if, like, say you're sexually active, what if you have an STD or your partner? Well, today, what if I told you that the rate of infected women and men has increased higher since 1997, and that the top two STDs are known as silent diseases because the majority of people that get them, they have no symptoms. But of course, there are ways to protect you. Learning about the actual ratings of infected women and men, and the preventions of how not to get an STD and how to protect yourself can help reduce the rates among people and help you live a healthier life and have safer sex. So I was able to learn how many STDs there are and how to prevent from getting them in the future. There are many reasons why every age group should be aware. So I'll be telling you guys the what's and the how's about the two top STDs, which is chlamydia and gonorrhea, and ways to prevent it, and I'm going to show you guys some protections. So the top STD is chlamydia, which is caused by the bacterium Chlamydia trachomatis. So how common is chlamydia? According to the Center of Disease Control and Prevention, last updated in 2010, women are almost 6 times higher risk than the rate among men. And it is an estimated that 2,291,000 non-institutionalized U.S. civilians ages 14 through 39 are infected with chlamydia, based on the U.S. National Health and Nutrition Examination Survey. How do you get chlamydia? It is usually transmitted through vaginal, anal, or oral sex, and also if a mother is infected, it could be passed on to their baby during delivery. For chlamydia, for teen girls and women, they are in higher risk because the cervix, which is the opening of the uterus, is not fully matured. So, like I said, usually you don't get any symptoms, but if you do, you get them within 1 to 3 weeks. And according to the pamphlet of STD Facts, last revised on 2009, women get discharge from the vagina, and discharge is pus, and bleeding from the vagina between periods, burning and pain when you go urinate. You usually need to urinate often, and you usually get fever and nausea and pain in your abdominal. For men, they get watery and white drips coming out of the penis, and burning and pain when you urinate as well. You also need to go urinate often, and you guys usually get swollen or tender testicles. And so secondly, I'll be talking about the top two STD, which is gonorrhea. So gonorrhea is caused by that bacteria Neisseria gonorrhea, and it is, so how common is it? It is estimated that 700,000 are infected in the U.S. each year. What are the symptoms? If you, like I said, it is a silent disease, so if you do get it, you get it within 2 to 21 days after having sex. And the symptoms are similar to chlamydia. So you also, for women, you also get bleeding from the vagina and all that, and then So and I got that from the American Social Health Association. So after hearing these facts about chlamydia and gonorrhea and how you, now I will guide you in how you could prevent and protect yourself. So preventions are just basically not having sex, but if you do, it's better to just have it with one partner that is not infected. And some protections can be, they recommend latex condoms, which I think everybody's familiar with them. A female condom, in case you guys haven't seen them. And this is the first time I have seen it, but it's a dam, it's like a little sheet of paper, and you use it for oral sex for a woman. I put it right there. And then for oral sex, for anal sex. And I was told that, well, you could use it like when someone wants to lick the butt. I don't want to do that. So just remember, if you are having sex, just think twice because you might have it. So that's it.